Hello, welcome back everyone. And here we are already here arriving at our favorite segment, which is See the Stories. So today is International Anti-Drug Day, and recently there are a lot of news. There's one specific news actually that has a relation to one of the public figures, a musician.
It's been going viral, yeah?
Yes, it's been going viral after the family matters and all that, now the drug. But before we talk about that, we have our guest today. Let's have a look at this following story.
International Anti-Drug Day is observed on June 26 and aims to raise global awareness about the danger of drug abuse. As established by the United Nations in 1987, the day highlights the need for strong actions against drug trafficking and support for those affected by addiction.
It encourages education, prevention and treatment efforts while promoting global cooperation to combat drug-related challenges. Communities and organizations around the world come together on this day to advocate for a drug-free society and better access to treatment and prevention services. So in observing International Anti-Drug Day, which is today, we now will talk about handling and healing drug addiction with psychiatrist Dr. Aminah Alaydrus, or known as Dr. Mia. Good afternoon. Good evening, actually, Dr.
Good
Mia.
evening.
Good evening. Good evening, Alia and Ahir.
Yeah.
Thanks for welcoming me.
Yes, of course. We are very honored as well to have you. So recently, if you've been watching the news, there's a musician who was recently arrested on a drug case with the excuse of losing weight.
Yeah.
Does drug do that to our body?
Yeah. Actually, we talk about narcotics, psychotropics, mostly, and most of them have side effects, especially stimulants. If we talk about psychotropics and narcotics, there are three main groups, and one of them is stimulants. If they, actually I didn't read much about the news, but mostly if people use stimulants, the side effect is they can lose weight very soon, like very fast, very rapidly, and it usually used for so that you can suppress your appetite.
Oh, appetite.
Yeah, and that's why the side effect will be weight loss. And because of that, we can use that this these people misuse the drug. It's actually not for weight loss, because if you need to weight loss, supposed to be you go to
dietitian or something, or go to the gym
for the right reason. So that's why we sometimes, and mostly they misuse the drugs. And one of the group of the drug we talk is like sedative and hypnotics. Mostly they also misuse the use of the drugs itself. So they use it for another reason. So it's like an appropriate use, and that eventually leads to addiction. Eventually, like that, yeah.
Okay.
So, Dr. Mia, since today is the World Day of Anti-Drug Day, and maybe you can enlighten us by giving some numbers, like how is the prevention of against the drug? Because the theme for World Drug Days 2024 is the evidence is clear, invest in prevention. So how's the development from the government side, for example?
Yeah, actually we have the board for this, like we know as BNN, National Narcotic Board. Previously we use this BNN for this proposed, but as we know, our psychiatrists is not many in Indonesia. We in Jakarta alone, we lack of psychiatrists, or like nearly enough. So if we want to prevent the relapse, or for emergent new condition, we need many psychiatrists actually. And we, about the numbers itself, I not quite update about it, but it is actually a challenge for us. In psychiatry alone, there is a subspecialistic for addiction alone. And there is drug addiction, there is behavioral addiction. So we have so many problems actually in Indonesia. We know that a lot of population in Indonesia alone, and it is also a challenge to prevent that. Prevention will take many stages before it happened, after it already happened, and after it already stopped. So we prevent another occurrence.
Right.
So it's a really big challenge actually. So it's quite hard, but our government already trying to provide for the services actually.
I mean, in your ideal sort of like point of view, how could we actually create this environment that is prevention, more onto the prevention of drug abuse or drug addiction? Would you like do something differently than what you are doing right now, or maybe you could go and educate more people in order to prevent them from having drug addiction?
Okay, as I told you before, there are lacking of psychiatrists, but it doesn't mean that it's only psychiatrists that can do and help people with addiction.
Right.
We can like share the burden with another mental health providers or just health providers. Like in Indonesia, primary care, like in puskesmas, like something like that, we can do the prevention in the form of education. So we can tell the people. Actually, sometimes our aim is teenagers, maybe children nowadays. So we can go to the schools. So the primary care can cooperate with the schools.
Right.
It's the biggest thing that we have to do in Indonesia because we lack of information actually.
Okay.
Right.
Yeah.
But
so
if you get categorized by age, for example, what are the biggest chunk of age group that is on the line or on the segment of addiction?
The group age that have a high risk to have this addiction, actually mostly is teenagers or young adults.
Young adult.
Yeah, because mostly during teenagers we want to try new things, we want to be accepted by our peers, and mostly that's
Is it during high school or middle school?
middle and high school. It
Middle
can
school.
be. If we talk about narcotics and psychotropics, it also includes cigarettes.
Right.
Cigarettes.
Yeah, and don't forget about cigarettes.
Oh, okay.
Cigarette is mostly widely used in Indonesia, especially men, right? Even though
Or
women
boys.
too. Yeah, and actually we can see nowadays that many young boys can smoke cigarettes very freely. They are, population at risk actually. But
Population at risk.
both men and women are actually at risk, especially during that stage of life that they are still trying to find themselves.
I'm not sure how they could get the cigarettes. I mean, we don't have, we used to have, or at least we now have, rules if, they go to a shop or something, they want to buy cigarettes for a certain age. There should be an age
Limitation.
Above
Yeah.
17.
Yeah.
Yeah, it's actually socially and normally we sometimes question about this, but actually they are smarter than us to get the
Could use somebody
drugs.
older to get the
Yeah,
cigarettes.
maybe they paid, they chipped in for 10 people, maybe they just have some ways to get it, and behind their parents, behind any adults surround them. Because if you ask about how can they get them, most of my patients, addiction patients, they can get the prescribed
Oh.
drugs. I didn't prescribe it, so in black market.
In black market.
Right.
Yeah, so they always have ways from the friends, or sometimes if they are, naughty, they can go to another doctor with the same excuse or anything.
Wow. All right.
Yeah.
Wow, I can't imagine. I mean, in old days, such as when we
our
were
kids.
young.
Oh yeah, when we were young, and now we have our
we
kids
didn't
at that
think
age.
about that way, yeah. But now they
Yeah.
even think that got some prescribed drugs that
Drugs.
could goes to the drug abuse or drug
Yeah,
addiction.
yeah, that's
So yeah, even if the theme of World Drug Days 2024 is the evidence is clear, invest in prevention. You've mentioned that actually, like a group of age young adult is like a
The
one
prone
from-
ones.
Yeah. So how should we, community helps, and also you from the psychiatrist,
yeah. Actually, if we
help
talk,
to reduce it?
yeah, it's actually been our goal for so many years till now, I guess, how to reduce it or how to stop it. But it's again, this is a complicated situation actually, because they don't look very sick, or maybe some people can still work.
Productively.
But, yeah, sometimes at some level they can do like that, but at some level they, because there is severity for this addiction matters, and it depends on what drugs they use.
Right.
It has different effects. So it's very complicated because one, for all many psychiatry disorders, there are stigma, social stigma, and then have to be broken actually, because in order to get them to get help, they need to have motivation to change. And sometimes they don't want change because the people around them will still see them as bad as they were before.
It's not changing anything.
Yeah, so why do I have to change?
They
It doesn't
have their
help
own
me
stigma
anything.
for that,
Yeah, and I don't feel any good after I stop, and I feel better when I take the drugs. So that's the one. And then second, maybe money. It takes money, right, for to get help like that. But our national health insurance sometimes cover it. But then again, we have so many people, but not that many hospitals around Indonesia. So it will be a challenge also to get them control routinely, regularly. Sometimes they can go this month, but because so many patients, they cannot get into the queue, and then they will stop from the control like that.
So, I mean, as
that's
simple
many.
as schools doing a urine check, for example, that can also be indicating if one person is taking drugs or not, right?
It is the most widely used for accepting new employee, I guess, like in many companies. But then again, if the urine test came positive, it doesn't mean that they use drugs, because many drugs, it doesn't have to be psychotropic drugs like for depression or anxiety,
But also
it will give false positive. So then again, it has to be very thorough examination and assessment to judge somebody if they're using the drugs.
Okay, so how does the drug rehabilitation process take place, and how long does it usually take? You said there might be doing the same kind of cycle again after they stopped.
Yeah, actually it depends on the severity. For rehabilitation program in our BNN, they mostly cover for 3 months, 90 days, yeah. But actually it depends again on the severity and on individuals'
Motivation.
Yeah, sometimes it can be for 30 days until 90 days. It depends on others.
So 1 month to 3 months.
Yeah, but on the rehabilitation, they are covering so many things, including behavioral changes. So it doesn't. It's not just for stopping the drug or cessate the drugs, so that they can stop, slowly. But they can. They will also teach how to avoid or how to handle the craving or handle the, body sensation that really very, very uncomfortable for them.
So what is the biggest challenge usually for a drug addict to stop? Is it because of the surroundings that offer them again and again, or is it because of the body craving, as you mentioned?
That can be many aspects. First, emotionally, and then socially, and then biologically.
Wow.
Emotionally, some addicts can be emotionally addicting to the drugs, emotionally and physically.
Right.
And by physically, I mean if you stop the drugs, the body feels very uncomfortable. For some drugs, it can lead to seizures, coma, or nausea, diarrhea, very, very uncomfortable.
Difficult.
Yeah, so they think that, why, I'm not comfortable
Yeah.
to stop these drugs.
We'll just
Right.
do the
Yeah,
same.
and then second, emotionally,
Right.
they feel that if I, lessen the dose or even stop, I cannot function. I cannot be motivated. I cannot do anything all day. So I have to use these drugs.
Right.
It can be true. It can be not that true. There's emotionally addictive for them. So
Right.
it's really, really challenging.
Challenging
Yeah.
and complicated as
Very, very
you've
complicated.
said earlier
Yeah.
just
Because
now.
not only socially, but also biologically inside them. And biologically and also emotionally, it's very, very conflicted for the
A person who
Yeah, for the
is
person.
going through with that condition. Yeah. So let me quote from the UN website, talking about this one. This year, World Drug Day campaign recognized that effective drug policies must be rooted in science, research, full respect for human rights, compassion, and a deep understanding of the social, economic, and health implication of drug use. It is a very comprehensive
Very,
approach
yeah.
for that.
Yeah.
And
Yeah.
it is complicated for, let's say, a patient for going through and pass through that
The phase
severe
of-
and the bad
yeah.
situation. So, talking about the role of the community in terms of rehabilitation in Indonesia,
Yeah.
what do you suggest?
in community. So
Yeah.
we mostly we don't talk about the health providers. We talk about the parents, the family, the friends, or authorities around them. So back again to social stigma. Mostly, there are some of my patients that they already stopped using and already really low dose, but the surroundings say that this person is still bad. So I don't want to employ them, I don't want to hire them, already bad stigma like that. And that can lead to depression or anxiety because they need money, they need something to make them very useful, especially if they have family, maybe spouses or children or even old parents mostly. My parents maybe divorced and then they have to take care of the parents.
Yeah.
But the parents keep yelling at them because of the history of this misuse of drugs.
It is something that is still happening here in Indonesia.
Still happening on my patients
On your
actually,
patients.
mostly like that. So it's really, really saddening, I guess, because most of them, or maybe some of them, already tried to be better or try to be good.
Yeah.
But the society still
Set-
label them
Yeah.
as bad as they before. So they don't see them as they are right now.
Yeah.
So that's very, very saddening and hard to convince my patients actually.
Yeah.
So based on your experience and your expertise, what is the suggestion for us, the community, beside
For the families, it's
Yeah,
probably
yeah.
the hardest, right?
Yeah,
Or maybe
maybe-
for the communities in general.
Yeah, maybe first of all, we don't have to see a person as they were before or just the flaws. We can see them as we see them right now, what they give to us right now.
Yeah.
If there are flaws, we can see, do they have the intention to change, or can we see the behavior to change? Mostly on my patient, my patient already have a wife and children. The wife constantly get angry to my patient because they still consume the drugs. But the drugs that I give him is for rehabilitation actually. I keep lower the dose. It's not as big as much as before. So it's on treatment, ongoing treatment. But the wife still thinking, you still take the drugs. I don't like it. I want a divorce, something like that. And my patients have dual diagnosis, actually. Depression also, and still going on addiction like this.
Wow.
So it's very hard for him.
Yeah.
And they have to, he have to look for job, but not so many jobs for him.
Yeah.
So yeah, you know, imagine that.
Wow, Dr. Mia, thank you so much for enlightening us on the
Yeah.
situation. That's kind of like a tangled circle
Yeah.
inside these addictive or addicted people.
Yeah.
But at least we want to make sure that there is a turning point for them. And it's not only the responsibility of that addict, but the community as well. So stay tuned, and for the next See the Stories, we'll continue after the break. We'll play some games to test whether we understand about this anti-drug day.
Yes.
Yeah, we'll be back.
Don't go anywhere.